The impact of higher than expected utilization levels for Medicare Advantage products could lead to a deterioration in profitability and adversely impact health insurers' overall financial results. That, according to a new AM Best commentary. I'm John Weber for AM Best TV, and we're joined today by the authors of that report, financial analyst John Housel and senior financial analyst John McGlynn. And John, starting with you, this report follows up on some fairly recent AM Best analysis of this trend around Medicare Advantage products. Can you explain what's happened here during the course of 2023 in terms of these increased utilization rates?
Yes, thank you, John. As detailed in the report, there was a rise in outpatient and supplemental benefit usage within the Medicare Advantage segment. Several companies commented that outpatient services for seniors undergoing orthopedic and cardiac procedures became more prominent through the year. Additionally, the introduction of the RSV vaccine later in the year also drove increased utilization. This was partially driven by insurers' ongoing efforts to encourage seniors to utilize their preventative care visits. However, these preventative care visits may have led to additional necessary care, specifically for those individuals who have not seen their doctor in some time. Consequently, these unfavorable trends pressured financial results for Medicare Advantage insurers.
How prepared were the MA providers for these developments, John?
Medicare Advantage insurers were at a disadvantage for the year, as rates they filed were in June of 2023 before the unfavorable trends were captured. Insurers have acknowledged that some of the elevated medical trends were incorporated into their 2024 pricing, but not all. Moreover, the final notice by CMS in 2024 was considerably lower than in previous years, which will further affect margins for 2024. We saw insurers, as a result, revise their full year 2024 outlooks to reflect the uncertainty around these Medicare Advantage trends. However, these insurers believe that they will be able to withstand the narrow margins within the segment, and earnings from this segment are expected to remain profitable, although lower than in prior years.
John McGlynn, what role does Medicare Advantage play in the overall health insurance segment's financial performance and the results as well?
Yeah, it plays a large and growing role, John. In 2022, MA represented over a third of the industry's underwriting gains and has been a primary driver of growth over the past 5 years. MA experienced tremendous growth over the last decade due to a combination of more Americans aging into Medicare eligibility and a greater percentage of those seniors choosing an MA plan over traditional Medicare. Now, margins are narrower in MA than they are in the fully insured commercial market. But the higher revenue from CMS payments and member premiums combined with just the sheer number of members has made MA a very large contributor to industry profitability.
So what will be the impact on Medicare Advantage providers as we move through 2024 and into 2025?
It's likely we'll see margins narrow in 2024 and potentially into 2025. Companies that did not include the increased utilization in 2024 pricing will not be able to correct mid-year and should expect thinner margins if the utilization John Housel noted earlier continues. There may not be much relief coming in 2025 either, as CMS's initial base rate indication for 2025 is lower than it was in 2024. Though it remains to be seen if the final notice will match the initial indication. However, the rapid growth of MA has experienced in recent years is likely to continue, as the United States is reaching what we call peak 65, with 4.1 million Americans turning 65 every year from 24 to 2027, and that's 11,000 every day. And per the Kaiser Family Foundation, Medicare Advantage now makes up a majority of seniors. They choose this plan now over the traditional Medicare. So given that the transition of more Americans into the program, we can expect Medicare Advantage to capture kind of its fair share of additional seniors, which should propel growth into the future.
Thanks, John. John.
Thank you.
That was financial analyst John Housel and senior financial analyst John McGlynn. You can find the full report online at ambest.com. For AM Best TV, I'm John Weber.